Welcome to the deep dive. You send us what you're reading, and we dig in to pull out what really matters, fast, thorough, so you get the knowledge without feeling buried.
Exactly. And today, we've got a really compelling piece a listener sent over. It's called Episode 245, The System Was Built This Way, from Operation Paperclip to HHS. It looks at, well, the deep historical roots shaping autism policy and care in the U.S.
Right. So our goal here, our mission for this deep dive, is tackling that big question.
Yeah.
How have these, past events and the ideas behind them shaped how we deal with autism now, often in ways we don't even see?
Mm-hmm.
We're going to explore some connections that might surprise you, like links between science from the Nazi era and practices still around today. So where does the author start us off?
Well, the piece kicks off with a reflection on RFK Jr.'s appointment at HHS, the Department of Health and Human Services, and this sort of controversial proposed autism study. And for a lot of people, especially folks who've been through institutional systems around neurodivergence, it apparently sparked this feeling of, like, we've seen this before, this echo of behavioral correction approaches from the past.
Right, that sense of inherited history.
Yeah.
So the author jumps right into these fundamental questions, like what happens when systems are built on the foundations, the sort of bones of older regimes?
Exactly. And what's the effect of bringing people who were, architects of atrocity into new systems? How do these legacies, these ways of thinking, get sort of repackaged and embedded?
And the point is, these aren't just theoretical questions. The author argues this is like the very ground we're standing on when we try to understand current autism issues.
It's foundational, yeah. You can't understand the now without looking at the then, even if it's hidden.
So the first big historical piece brought up is Operation Paperclip. Can you give us the rundown on that?
Sure. Operation Paperclip. It was this U.S. program right after World War II. Basically, they recruited over 1,600 German scientists, engineers, doctors, even intelligence officers who'd worked for the Nazis.
Wow.
The goal was to get their expertise for the U.S., especially with the Cold War kicking off.
And some of the names are pretty well known, but maybe not their full history. Like Wernher von Braun, V-2 rockets, then NASA.
Right. And Kurt Davis, he was an SS officer. Then he directed launch operations at NASA. It gets complicated quickly.
Yeah, it does.
And then there's Reinhard Gehlen. He ran Hitler's intelligence on the Eastern Front. Post-war, the CIA helped him set up West Germany's intelligence agency, using his old network, many of whom were ex-Nazis.
Starving.
And Hans Speidel, also involved on the Eastern Front, later became a top NATO commander.
So the key takeaway here isn't just that they hired these people. It's that their Nazi pasts were often, whitewashed? Ignored.
Yeah, downplayed or outright concealed. And crucially, the author argues the ideologies they held weren't necessarily left behind in Germany.
It was just seen as practical statecraft during the Cold War.
That was the justification, yeah. Pragmatism over morality, perhaps. And the author points to a similar situation in Japan with Unit 731, horrific human experiments, biological warfare.
And the U.S. gave immunity?
Immunity for scientists like Shiro Ishii in exchange for their research data. It's a disturbing parallel.
So the argument isn't just about getting smart people. It's described as an ideological graft, right? Embedding certain ways of thinking maybe about control, efficiency right into American systems, government, medicine.
Psychiatry, education. Yeah, that's the core argument. An ideology prioritizing control got woven into the fabric.
Okay, so building on that, the piece then shifts focus to Hans Asperger and Leo Kanner, big names in autism history. But the author looks at them through this lens, this historical context.
Right, and it presents a view of Asperger that's, well, much darker than the usual story. It suggests he wasn't just a clinician, but actively involved in Nazi eugenics.
How so?
The piece details his connection to the child euthanasia program, sending disabled kids, the ones he deemed couldn't be useful, to places like the Spiegelgren Clinic where they were killed.
Oh, wow.
His focus, it seems, was on molding the salvageable ones to fit into the Reich, not really on understanding or supporting their differences.
And Kanner, in the U.S., obviously no Nazi connection, but his work was happening during the peak of American eugenics, wasn't it?
Exactly. And the author argues that influenced his work. His early definition of autism, for example, tended to leave out working-class kids, non-white kids. It focused on a specific group.
And the whole refrigerator mother theory.
Yeah, blaming parents rather than looking at, the child's actual neurology or environment. So in both cases, the author argues, autism kind of became this label used for sorting people, for pushing conformity rather than understanding.
And here's a really sharp irony the author points out. Eugenics wasn't invented by the Nazis. It was big here in the U.S. first.
Absolutely. People like Charles Davenport, Madison Grant, big institutions like the Carnegie Institution, they were pushing eugenics hard in America. Sterilization laws, racial theories.
And the Nazis actually looked to the U.S. for inspiration.
They did. They studied American eugenics laws, especially sterilization practices, when crafting their own horrific policies.
And then there's IBM's role. That's chilling.
Yeah, the punch card technology. IBM's German subsidiary, Dehomag, provided the tech that made the Nazi system so efficient at, well, sorting people, tracking them, deporting them.
It really shows how categorization, just putting people in boxes, can become policy with deadly results.
And that logic, the author suggests, seeped into how autism was initially handled in psychiatry in the DSM. The focus was on cataloging behaviors, identifying, maybe containing, not so much on support.
Okay, this is laying some heavy groundwork, which leads us, I guess, to Applied Behaviour Analysis, ABA, and its founder, Ivar Lovaas.
Right, often called the father of ABA. And this is where the author introduces findings from a 2025 study that apparently uncovered a hidden part of Lovaas's past.
What did it find?
It found that Lovaas was a youth leader in Norway's fascist party, the National Samling, during the Nazi occupation. He joined their youth wing, went through leadership training. His father was a high-level propagandist for them. Both were apparently listed in Norway's treason archive after the war.
And this wasn't known or discussed as he built his career in the U.S. promoting ABA.
Apparently not widely, no. And the author argues this context is crucial for understanding ABA's core principles.
Which are?
Well, the piece argues the fundamental goal was, and often still is, shaping autistic behavior for palatability, for compliance, making kids indistinguishable from their peers through conditioning.
Rather than supporting their actual needs or accepting their differences.
Exactly. And the author draws parallels between ABA methods and techniques used in, well, other contexts focused on controlled prisons, animal training, even military interrogation. There's a through line, as they put it, of seeing difference as deviance that needs fixing.
Yet ABA became mainstream.
Yeah.
Got integrated into schools, covered by insurance.
Because it promised results, right? Measurable changes, order, and often, the author suggests, without institutions really grappling with the founder's background or these deeper historical resonances.
But then the author brings in a really important nuance, the perspective of African American families. For them, this focus on compliance in ABA, it takes on a different meaning.
A life or death meaning, potentially, because Black people in general, already face intense scrutiny and policing of their behavior, their difference.
So ABA in that context might feel like a defense mechanism.
It can become, as the author puts it, a grim kind of armor, a way to try and protect their autistic children from a society that's quick to misunderstand and punish Blackness, especially when it deviates from the norm.
And that's an indictment of society, not the families choosing it.
Absolutely. The author makes that very clear. It highlights the impossible choices families face in a biased system.
So, tracing this forward, these ideas, this legacy of classification, correction, the focus on the norm, they get inherited by institutions like HHS, the CDC.
That's the argument. That the language we see in public health documents about autism, things like prevention, early intervention, risk reduction, can sometimes echo those older logics of wanting to contain or even erase difference.
And RFK Jr.'s appointment at HHS, that proposed study, the author sees that as potentially reflecting these lingering suspicions about autism, maybe even his anti-vaccine views, which the author notes can have eugenic undertones.
It fits into that larger pattern the author is describing, yes, this continuity of certain underlying assumptions.
It does make you wonder, as the author asks, why the U.S. hasn't had a real formal reckoning, like a Truth and Reconciliation Commission for people harmed by things like forced sterilization, institutionalization, unethical experiments.
Right. The author suggests the American narrative, the story we tell ourselves about being liberators, about exceptionalism, has maybe made it hard to look squarely at these darker parts of our history, including the ideologies we imported or fostered.
We talk about the Nazis borrowing from U.S. eugenics.
Exactly. And things like sterilization continued in the U.S. long after the war. But this kind of sanitized self-image, as the author calls it, allowed individuals and institutions to avoid scrutiny. It creates a selective memory, forgetting the violence, silencing the survivors.
And this legacy isn't just history, is it? The author argues it's alive now in our current systems.
Very much so. In the surveillance that happens in schools, healthcare, policing, where fitting in, assimilating is often the price of participation or even just safety.
Can you give examples?
Well, things like behavior intervention plans in schools that might focus solely on stopping autistic behaviors rather than understanding the need behind them. Social skills groups teaching one specific right way to interact. Healthcare defining good outcomes as being less noticeably autistic.
So good behavior becomes this kind of currency. Autistic people learn to mask to perform.
Yes, often at great personal cost. And the author even points to dynamics within neurodivergent communities, like Aspie supremacy, where maybe those who can pass or fit into the system more easily are valued over others, creating internal hierarchies.
It's a complex and frankly quite disturbing picture. So what's the way forward, according to the author? They talk about refusing the inheritance.
It means actively questioning these logics we take for granted, questioning the support systems that demand conformity as the price of admission.
Acknowledging the harm that's still happening.
Exactly. And looking beyond just trying to tweak these existing systems, the author points towards the wisdom that already exists in disabled communities, in neurodivergent storytelling, in community-led care models.
Models based on making space for difference, on autonomy.
Autonomy, interdependence, genuine acceptance. It's about reimagining the whole terrain of care, not just patching up a fundamentally flawed structure.
So the ultimate conclusion is pretty stark. The systems weren't neutral. They were built, in many ways, to sort, correct, control. And the cruelty wasn't an accident, but part of the design.
That's the hard-hitting takeaway. The author shares this personal aha moment reading about Lovaas' past, how it confirmed this deep-seated feeling that the roots of behavioral control went back to eugenics, to this idea of control disguised as help.
And knowing this history, this context,
Yeah.
it removes the excuse of neutrality, doesn't it? It forces a reckoning.
It demands it. And yes, there will be pushback, especially from, say, the ABA industry, but the author stresses we need to start that reckoning ourselves.
How?
By naming the harm, by really listening to survivors, by putting neurodivergent knowledge and experience at the center.
And the author ends on this powerful note. Despite everything, despite being in systems never meant for us, autistic people are still here.
Still here, naming it, refusing it, and imagining what comes next. It really leaves you, the listener, thinking about where you stand in all this and what role you might play in shaping that future.